and I'm going to be your nurse today.
Hi.
Hi, can you please tell me your full name?
Haley Bowman.
Hi, Haley. So based on your questionnaire, I'm going to be conducting a neurological exam. Is that okay with you?
Yeah.
So during my neurological exam, I'm going to speak my findings out loud, especially when I'm doing your cranial nerves. And then if you have any questions, I can answer them, okay?
Okay.
So first, I'm going to ask you a few orientation questions. Can you please tell me where you are?
Home.
Okay. Can you tell me what month and year it is?
October 2019.
Perfect. Okay, so your appearance seems to be appropriate. Your posture is nice and tall. You don't have any tremorish looking motions. Your grooming appears to be intact. Your speech is clear and concise, and you're alert and oriented. Now I'm going to assess your lymphatic system. So first I'm going to inspect, and then I'm going to palpate. So I'm going to look on both sides of your head, and then I'm going to touch you. I do not see any visual nodules or lesions, so now I'm just going to rub in certain areas. So in your preauricular, and then your posterior auricular, your occipital region, and your superior cervical, and then your deep cervical. And can you just hunch your shoulders a little bit forward? Awesome. I'm going to do your supraclavicular. Okay, I don't feel any nodules. Was there any tenderness in any of the areas? Okay, perfect. Now I'm going to be assessing your thyroid. So can you please take a seat for me? First I'm going to inspect and have you take a sip of water. I'm going to watch you swallow. Wonderful. Now I'm going to come behind you, and then I'm going to have you tilt your head slightly to the right. I'm going to push on the left and feel. Can you take a sip? Wonderful. Now slightly to the left. Sip. Perfect. So I don't feel any enlargement of your thyroid and no nodules. So now I'm going to start assessing your eyes. Okay? So now you take a step back there. Start with the Snellen chart. Perfect. Glasses on. Now can you cover your right eye for me and read line number 6?
EDFCZP.
And line number 3?
TOZ.
And then cover your other eye. And then line number 6.
EDFCZP.
And then line number 3.
TOZ.
Perfect. So I didn't hear any hesitancy. You weren't hunched forward or squinting. You didn't miss any letters. So can you come sit back up here again? Okay. So now I'm going to be assessing your peripheral fields. So that's actually your optic nerve, which is cranial nerve number 2. So I'm going to have you cover one eye. And then I'm going to have you tell me when you can see wiggling of my finger.
Mm-hmm. Yep. Yep. Yep.
Okay. And now the other eye.
Yep. 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 Yep.
Okay, perfect. So your peripheral fields appear to be intact, which means your cranial nerve number 2 is also intact. Okay, now I'm going to assess your extraocular muscles. So this is going to assess 3 of your cranial nerves. Your third one, which is your ocular motor, your fourth one, which is your trochlear, and your sixth one, which is your abductors. So what I'm going to have you do is look straight ahead, and then you're going to follow my finger with your eyes. Ready? Don't move your head. Perfect. So I see no nystagmus, which means your cranial nerves 3, 4, and 6 are intact. I'm going to be assessing your pupils. So first I'm just going to look and measure, and I'll dim the lights. So your pupils appear to be round and smooth and equal bilaterally at 5 millimeters. I'm going to dim the lights now. Okay, now I'm going to have you look at my face, and I'm just going to put the light in both of your eyes, okay? Perfect. Okay, now I'm going to turn the light back on. Your pupils appear to be reacting indirectly and directly to light. Now I'm going to have you look over my shoulder and focus on something far away. And then focus on my finger. Perfect. Your eyes reacted appropriately to accommodation. They dilated looking far away and then contracted when you focused on my finger. And your lenses also appear to be clear. Now I'm going to assess your ears. So first I'm going to look externally and then on your external canal as well. to feel. Okay, I feel no lumps or cysts, and I don't see any drainage, edema, or inflammation, and your cerumen appears to not be impacted. Now I'm going to be performing the whisper test. This is going to be assessing your cranial nerve number 8 or your acoustic nerve. So I'm going to just put my finger in your ear and you're going to repeat after me.
8K9,
Perfect.
9B4.
Wonderful. Your acoustic nerve or cranial nerve number 8 appears to be intact. Now I'm going to do the Weber's test. Tell me which side you hear it. Okay, and now I'm going to do the Ryan's test. So I'm going to put out your mastoid process and then your ear. You're going to tell me if you hear it more behind your ear or when it's at your ear.
When it's at my ear.
Okay, on this side.
It's at my ear.
Perfect, so you have a positive Ryan's test. Next, I'm going to be assessing your olfactory nerve or your cranial nerve number 1. So I'm actually going to have you close your eyes, cover one of your nostrils. Okay, now tell me what you smell.
Cinnamon.
Wonderful. Now the other side.
Like ethyl alcohol.
Perfect. Your olfactory nerve or cranial nerve number 1 appears to be intact. Okay, so next I'm going to be assessing your mouth. So can you open your mouth for me? I don't see any dental caries or chipped teeth. You're not wearing any dentures. And your gums appear to be pink, no inflammation, lesions, or active bleeding present. Now I'm going to assess your hypoglossal nerve. So can you open your mouth for me and stick your tongue straight out? Perfect. Your tongue appears to be midline, so your hypoglossal nerve number 12, or your hypoglossal nerve, cranial nerve number 12 is intact. Now I'm going to be assessing your cranial nerve number 9, or your glossopharyngeal nerve, as well as your vagus nerve, which is your cranial nerve number 10. So I'm going to actually take this tongue depressor, press down on your tongue, and have you say, ah, ah. Perfect. Now I'm going to touch your posterior pharyngeal wall, and it's going to make you probably cough. Okay? Ah, ah. Awesome. So your cranial nerve number 9 and 10 appear to be intact. Next, I'm going to be assessing your cranial nerve number 7, or your facial nerve. So I'm going to have you smile real big for me. Perfect. Now lift your eyebrows up and high. Awesome. Now can you pump out your cheeks for me? Perfect. Your cranial nerve number 7 appears to be intact.
Okay.
Now I'm going to be assessing your cranial nerve number 5, or your trigeminal nerve. So I'm going to be massaging your temporal and masseter and have you bite down and release. Perfect. Strong and equal on both sides. Now I'm going to have you close your eyes and tell me where I'm touching you.
Forehead. Left cheek. Right cheek. Chin.
Awesome. Your cranial nerve number 5, or your trigeminal nerve, appears to be intact. Now I'm going to assess your spinal accessory nerve, or your cranial nerve number 7. So I'm going to place my hand on your cheek, and then can you turn your head against resistance? Wonderful. And then this side. Perfect. Now I'm going to have you shrug your shoulders. Awesome. Your cranial nerve number 11 appears to be intact. I'm going to be assessing your fine motor skills and your coordination. So I'm going to have you go like this and pat your legs. Awesome. Faster. Faster. Great. Okay, now I'm going to assess your balance. So can you please step down? I'm going to do the Romberg test. So have your feet together, close your eyes. Perfect, no swing. Now I'm going to have you walk. Can you walk normally and then turn around and walk back? Okay, now I'm going to have you do it again, but can you step on your toes and then come back on your heels? Perfect. Your balance and coordination appears to be intact. Now I'm going to assess your spinothalamic tract. So I'm going to have you tell me if something is sharp or dull. Can you please close your eyes? All right.
Dull. Sharp. Sharp. Dull.
Perfect. Your spinothalamic tract appears to be intact. Assess your posterior column tract. So I'm going to hit this and put it on your greater toe. You can just tell me when you have the vibration stop.
No.
Okay.
No, so no.
Okay. Now I'm going to have you close your eyes for me. And then put your hands out. And I'm going to move one of your fingers. And you're going to tell me whether it's up or down. Let's do it this way so you can actually tell.
Down. Up.
Perfect. Your posterior column tract appears to be intact. Now we're going to do your tactile discrimination. So I'm going to have you shut your eyes and then point to where I touched you. Great job. Your tactile discrimination seems to be good. Now I'm going to assess for your stereognosis. So I'm going to have you close your eyes and then tell me what's in your hand.
Q-tip.
Perfect.
Key.
Wonderful. Your stereognosis appears to be intact. Now we're going to assess for graphaphasia. So I'm going to have you close your eyes and you're going to tell me which number I wrote in your palm.
7. 3.
Perfect. Your graphaphasia also appears to be intact. Okay, now we're going to do the 2-point discrimination test. So you're going to tell me whether you feel 1 or 2 points with your eyes closed.
2. 1. 1. 1.
Okay. So the last thing I'm going to assess as part of my neurological exam will be your reflexes. Now I'm going to assess your bicep reflex. So can I have your arm? Wonderful. And then this side. Perfect. So your bicep reflex appears to be +2 bilaterally. Now I'm going to assess for your tricep. And this side. Perfect. Your tricep reflex appears to be intact, +2 bilaterally. Now I'm going to assess your brachioradialis reflex. So I'm going to hold your thumbs up. Okay. Perfect. Your brachioradialis reflex appears to be intact, +2 bilaterally. Now I'm going to do your quadriceps. Okay, so your left quadriceps appears to be +3 bilaterally, and your right appears to be +1. Now I'm going to assess your Achilles. So your Achilles reflex appears to be +2 bilaterally. Now I'm going to assess for your plantar reflex or your Babinski reflex. So can you lay down for me? All right. Perfect. Wonderful. Your toes curled instead of flared, so your Babinski reflex is intact. Based on my neurological assessment, we found that on the Weber's test, you could only hear it on your left side, that your 2-point discrimination was off on your left arm. You were supposed to feel 2 points and only felt 1. And then your reflex in your knees were off. So your quadricep reflex on one side was +3 and the other was +1. I would suggest you go into a doctor to assess for your hearing based on my Weber's test findings, as well as your reflexes. Do you have any questions? Okay. So that concludes my neurological assessment. Have a great day, Haley.
You too.